if. Let's do some questions. So the first question there is, a 19-year-old man brought to the ED after overdosing on opioids is unresponsive with shallow respiratory and with a respiratory rate of 6. Oxygen saturation is low. What is the next step? So this patient is not protecting his airway, and he also has evidence of hypoxemia. And I'm sure with this low respiratory rate, if you do a blood gas, this patient is also going to be what? Hypercapnia. So this patient needs endotracheal intubation, right? Unable to protect his airway, hypercapnia, and hypoxemia. Those are 3 indications in this patient. Next question, a patient with pneumonia and FiO2 of 100%. Remember, FiO2 of 1 means 100% FiO2. PEEP of 5. Oxygen saturation remains at 88%. What's the next step? So we've already maxed out on FiO2 because this patient is already on 100% FiO2, but we still have rooms on the PEEP, so we can go up on our PEEP. So I think the best answer there will be increased PEEP, so we can go up on the PEEP. The next question there is a patient has been stabilized on ventilator with oxygen saturation of 98% on FiO2 of 0.8, so that means that's 80%. What is the next step? Like we said, you have to win the FiO2 below 60%, right? So the next step would be to reduce what? The FiO2. You don't want to leave patient on too much of oxygen for long, especially if they've been stabilized because of risk of what? Oxygen toxicity. Next question. A COPD patient is intubated and this is blood gas, so pH is still on the low side and the CO2 is still on the higher side. Which adjustments helps correct the hypercapnia? As we know that the minute ventilation equals respiratory rate multiplied by tidal volume. So we can either go up on the tidal volume or the respiratory. So let's see what we have in the option. So the best answer there would be what? To increase respiratory rate. The next question here, a patient with severe asthma attack is intubated. What strategy is most appropriate? Remember, like we said, with asthma attack, the rate needs to be on the lower side. So the best answer there will be lower respiratory rates to allow prolonged expiration. Next question, a patient with septic shock is on a PEEP of 8. And then shortly, the blood pressure drops. What's the cause of this? So this patient with septic shock, maybe a little bit of maybe the patient is also volume down, and now put them on a lot of PEEP. Remember, we said that PEEP increase intrathoracic pressure, and that will lead to what? That will increase the pulmonary resistance, and that could decrease the venous return, thereby decreasing the preload. So I think the best answer there would be what? Decrease venous return due to high PEEP. And the last question, a patient with moderate ARDS, acute respiratory distress syndrome, requires high oxygen support. According to the ARDS-NET strategies, which combination is typically used? Remember, in patient with ARDS, you want to do lung protective ventilation. And what does that mean? Low tidal volume, higher PEEP. And the best answer there would be what? E. Thank you guys for watching. Don't forget to like, subscribe, share this video, and I will see you guys in the next lecture. Bye.